Gentlelady yields back, and I now recognize my friend and other pharmacists in Congress, Representative Buddy Carter from Georgia.
The oldest pharmacist in Congress, by the way. Thank y'all all for being here. Mr. Moore and your organization, PCMA, often claims, with caveats, of course, that your industry saves consumers and patients billions of dollars. As you heard, I'm a pharmacist, so I know that that's not true. I know what's going on. In fact, PCMA says that PBMs make healthcare more affordable and accessible for all Americans. I would also refute that. Yet the Federal Trade Commission has found that the big three PBMs, are charging enormous markups on dozens of life-saving drugs and reimbursing their affiliated pharmacies at a higher rate that they paid their unaffiliated pharmacies. I know because I had an unaffiliated pharmacy. I had 3 of them, and I know what the reimbursement was. In 2022, for example, a large share of the drugs marked up by more than 1,000%. 1,000% were taken with patients with cancer, with pulmonary disease, with multiple sclerosis, a number of different things that they had to have these medications for. And in fact, the pulmonary hypertension drug, tadalafil, pharmacies purchased the drug at an average of about $27 in 2022. But the 3 big PBMs marked up the drug by $2,079. They were paying their affiliated pharmacies $2,106 on average for a 30-day supply of the medication. That's an average markup of over 77,000. 77,000%. In light of these findings, Mr. Marlin, can you still stand by PCMA's claim that PBMs made health care more affordable and accessible?
Yes, Congressman, I appreciate your passion on these issues, and I look forward to working with you as well. Yes, we saved $333 billion
How
last
can you
year.
explain when you marked it up 77,000%?
I'd have to look at that case specifically, Congressman, but let me tell you, I understand the concern about independent pharmacies across the country. They're critically important to the work we do. We can't do it without them. I think there is some good news from PBMs writ large, reimbursing them at higher rates, for example, moving to cost-plus contracts, reimbursing for the clinical services that they provide, but there's still a lot more work to do, and I look forward to doing that with you.
Well, good. I hope that you're sincere in that, and I have no reason to believe that you're not, and I'm going to hold you to it. You know that. Let me ask you something. The Federal Trade Commission recently reached a settlement with Express Scripts to lower drug costs and improve transparency. Chairman Ferguson, who I think personally is doing a great job, the settlement requires Express Scripts to make fundamental changes to its business practices that increase transparency and are projected to reduce patients' out-of-pocket costs for drugs like insulin by up to $7 billion over 10 years. This is important. Mr. Marin, as the National Trade Association representing PBMs, will PCMA commit to adopting the key terms of that settlement as a standard operating practices across all of its member companies?
Thank you, Congressman. Look, I mean, there's a lot of good stuff in there. There's also a lot of good stuff that the industry was already moving toward, right? Moving to cost-plus contracts, for example, higher reimbursement rates for independent pharmacies, $0 drug lists for patients with no cost sharing, enhanced transparency, passing through all rebates.
Understood.
The legislation that you passed also just 2 weeks ago includes tremendous transparency requirements.
Well, thank you. We're very proud of that. I'm very proud of it personally.
So I think
But let me ask you something. What about GPOs? They're based in foreign countries. Are you going to try to bring them back to America?
those are strategic business decisions that I would want to ask the individual companies to answer. But overall, look, you know, we use our purchasing
Wouldn't you
power.
encourage them to come back to America, though? I mean, that's the focus of this administration, is to try to get more manufacturing and more business back here in America.
I don't disagree.
Good. So I hope that we can count on you to help us with that, and count on your companies to help us with that.
And I think we can help get you the facts around those situations.
Okay. All right. Mr. Huey, thank you for being here. I appreciate it. We both know that PBM reform has been a long time coming, and the aforementioned wins that we had last week in the Consolidated Appropriations Act were significant, perhaps some of the most significant reforms in PBMs that we've had ever. And I'm very proud and very thankful to the members of NCPA for their help and their advocacy on this. Because after all, folks, we all want the same thing. We want affordable, accessible, quality health care. Pharmacists are the most accessible healthcare professionals in America. 90% of all pharmacists, of all citizens in America live within 5 miles of a pharmacy. They are the most accessible healthcare professionals, and as they begin to close, we impact accessibility to healthcare. I hope, Mr. Marin, that you will keep that in mind and that your organization will keep that in mind.
You have my pledge. Thank you, Congressman.
Thank you, and I yield back.
Gentleman yields